Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, internist and psychiatrist. Today's Kevin MD article is How President Biden's Cognitive Health Shapes Political and Legal Trust. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this important topic on the mental health issues related to politicians, specifically to the former and sitting current president of the United States.
All right. What's your article about?
So, American politics, discussing the mental health, the fitness of a sitting president, a former president, or other politicians is a very delicate and important topic. As a psychiatrist, I'm a member and a fellow of the American Psychiatric Association. And there's a important historical event. In 1964, there was the elections for the United States president. Senator Barry Goldwater, and who was the Republican candidate, was in opposition to President Lyndon Johnson, who was a Democrat. And at that time, Senator Goldwater had some conservative views that a lot of psychiatrists did not agree with. So there was an article in a famous magazine that actually surveyed psychiatrists to ask them their opinion. What do you think about the psychological status or the mental health status of Senator Barry Goldwater? What is his psychological capacity to be in office? And interestingly, about 12,000 psychiatrists chimed in and sent in answers. And the answers were quite revealing. One psychiatrist says, I believe that Senator Goldwater is suffering from chronic psychosis. Somebody says, well, he's a megalomaniac. Somebody even said, well, he is a paranoid schizophrenic who decompensates from time to time. Even one person says, I believe Goldwater has the same pathological makeup as Hitler, Castro, Stalin, other known schizophrenic leaders. But in reality, Senator Goldwater was actually a decorated Air Force pilot. He had been a senator for 2 terms and really had very minimal to no mental health issues. But actually, those comments are thought to have put their weight on the scale in that election, and Senator Goldwater ended up losing to Lyndon Johnson, who became the president. But in 1973, the American Psychiatric Association realized that ethical fault and actually adopted something called the Goldwater Rule, where actually psychiatrists are prohibited from making any comments about public figures without an examination and a consent of the subject. However, that because this issue has exploded, the mental health of a former president, a sitting president, people could make public comments about what they're seeing because these are things that we are seeing. So, for example, the former President Biden, actually on public television in a debate to millions of audience says, we finally beat Medicare. And so that was a significant comment that alerted people that there was something going on, even lay people, that there was something going on psychiatrically and psychologically with the former president. So I made a comment about that in holding of the Goldwater Rule, but I just discussed and reviewed what we see in our own naked eyes about what's going on with the former president.
So tell me, in terms of what psychiatrists are seeing, both with the former and current president, like, do you see the Goldwater Rule taking more or less relevance today?
I think the Goldwater Rule is still relevant. If you haven't examined the person, you shouldn't say, oh, I think this or I think that. But that doesn't take away from the fact that what you are seeing now with the proliferation of TV, YouTube, Reels, people can just create an impression that somebody is having significant psychiatric issues. Now, in the case that I talk about, which is the case of the former President Biden, I talk about the fact that he has documented, and he himself had talked about having brain surgeries in the past.
Mhm.
He's had two brain surgeries for cerebral aneurysms. And we know, and there is documented evidence that individuals who've had brain surgeries for vascular issues are at risk of developing cognitive issues later on in life. So that's settled research. We also know that he has some issues in terms of heart. He has atrial fibrillation. He has other medical issues. And that raised a lot of worry, especially with his public performance. We also worry about the fact that the secretive nature of not talking about what's going on with him, I think, really concerned physicians, concerned
Mhm.
the public about that. We just recently were informed that he actually has advanced prostate cancer, and that we know that that may also contribute to some of the cognitive issues. We were not really sure whether this advanced cancer was something that was operative or something that was ongoing while he was a sitting president. So a lot of the fact that these issues were not shared with the public. And people talk, well, it's the privacy, the Health Information Privacy Act, and the fact that when somebody becomes the president of the United States, most of these things are not non-applicable for them because they're a public figure.
Mhm.
Everybody needs to be assured that they're able to function. The DSM-5 also talks about and was updated to talk about the major neurocognitive disorder and about the criteria of that. And just as a layperson could actually match the criteria for a major neurocognitive disorder with what the former president was experiencing, and can easily reach a conclusion that they may be criteria that meet those public available criteria for a major neurocognitive disorder in the former president. So a lot of these things just need answers to allay the concerns of the public and us physicians about what's going on in our leaders.
To your knowledge, how stringent are neurocognitive tests done on sitting presidents and prominent political figures?
So a lot of the public figures, they hide their mental health issues. Mental health issues are perceived as weakness. Now, you know that we have some public figures that have advocated or that publicized their mental health struggles, their addiction struggles, and have carried them as a shield of solidarity with the American public, with patients. We know the Secretary of Health and Human Services has struggled with addictions in the past, has struggled with depression in the past, and he's been public about it. So the fact that some politicians, some public officials will talk about these things publicly creates the impression that those who are secretive about them, that there's something going on, there's something more than meets the eye, and that creates the difficulty with that issue. But these tests, I mean, are when politicians are running, they need to have a full battery of tests that become public with neuropsychological testing, especially for individuals who are older than age 65, age 70, full steam mini mental status exam, a MOCA test, and as well as more stringent, formalized neuropsychological testing for speed, comprehension, mathematics, things like that, that would give hints for any declining cognitive issues. Now, I bring that also the example of a practicing physician. If a practicing physician exhibited just a fraction of what the sitting president exhibited, a patient would quickly be calling the board of medicine, and the physician would lose their license very quickly and would be referred to the physician's health program and would not be able to practice. So it is very timely that we talk about these issues in a former president and be able to develop rules for the future for further assessments.
Now, as you know, we live in a highly polarized society, right? If as and everything will get politicized. So,
Sure.
how can we as a society have a necessary conversation about cognitive fitness without it being immediately dismissed as a partisan attack?
I think we can borrow that from the field of medicine. I mean, we do it all the time. I mean, we have colleagues who actually basically voluntarily relinquish, for example, the ability to do surgery because they think they're not sharp enough. We have colleagues that will, for example, restrict their practice to only outpatient practice when they realize that their manual dexterity skills as surgeons declines with age. So the field of politics should borrow a little bit from medicine in terms of politicians self-censoring kind of their ability to participate in a high stressful jobs like a job of the president of the United States that requires a lot of cognitive capacity and the ability to do these things. So, and we also have colleagues that will alert each other when we see another colleague who's struggling in a collegial and positive way rather than in a punitive way. Now, I understand that there's politics involved that, and that's why I brought in the Goldwater Rule, which happened in the 60s. That was a Republican candidate that was accused of having mental health issues versus a Democratic candidate. Now the shoe is on the other side, and we're having a Democrat being accused by the Republican establishment. So we've seen it both ways. So I think in terms of this being politicized, we need to draw that distinction that we are talking just about humans who may be suffering from conditions, and that the public needs to be notified about that.
So I'm hearing what you're saying, that politicians, perhaps over a certain age, like the age of 65, should undergo mandatory MOCA, mini mental status exams, neuropsychological testing on a routine basis, and those results be made public. Is that what I'm hearing from you?
I think that is accurate. I mean, that is accurate. Like us physicians, we have to take maintenance of certifications, we have to take tests, we have to demonstrate our competency and our ability to do the job. Similarly, politicians, their job is a cognitive decisions, high level decisions. They should be able to demonstrate publicly that they're able to perform these tasks. I watched yesterday actually a press release from the White House and a public showing something that happened. People started questioning that the current sitting president, President Trump, was experiencing visually that he was experiencing swelling in his lower extremities. And people put pictures on that his legs were swollen. And then the press secretary talked about the fact that he was tested. They did lower extremity Dopplers. They did lower extremity ultrasounds. They did lower extremity venogram. They did echocardiograms of the heart. They did a full testing to figure out that he had venous insufficiency of the lower extremity. That's a condition associated with individuals who are above the age of 70. And he was benign. They said, well, he did an echocardiogram of his heart. His ejection fraction was normal. There's no issues. People noticed blotching on his hands. So I think being proactive and public about it, if people had heard about that with the former president, yes, he's experiencing this. This is what's going on. That would have allayed a lot of concerns. So public information, I think, would be able to allay some of these concerns. But standards, I think, are very important. We know a colleague physician was actually interviewed by Congress to talk about the mental health issues of the president. And unfortunately, he invoked his Fifth Amendment rights and didn't want to talk about it and invoked the privacy of the president. But so these issues should be formalized. We need to have as a medical community, we need to come up with standards, and we need to say, well, this is what needs to be done in order for us to be confident that our leaders have the mental health as well as the physical health abilities to lead this country.
We're talking to Muhamad Aly Rifai, psychiatrist and internist. Today's Kevin MD article is How President Biden's Cognitive Health Shapes Political and Legal Trust. Muhammad, let's end again with your take-home messages that you want to leave with the Kevin MD audience.
Sure. The stakes, ethically, legally, and nationally, could not be higher. Transparency, medical integrity, and the constitutional clarity really must guide us. So in confronting these challenges, and discourse about former President Biden, his cognitive health, as well as health issues of current sitting president, we navigate not merely just medical intricacies of dementia, cognitive issues, or medical issues, but also the foundational trust upon which our democracy stands. So I think we need to have standards, and we need to advocate for those standards.
Muhamad, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thank you.